Hello everyone, and thanks for tuning in. And yes guys, it is Mental Health Moments. And guys, this is where I come in and I talk a little bit about mental health and how near and dear it is to my heart, because mental health is very important. And there are people out here who have mental health issues, and we may be that one who can pinpoint and get them to the person that they may need to get that help. So guys, I just want to let you know I'm not a doctor, I am not a nurse, I'm not a psychiatrist, I'm none of these things. I'm just a young lady that comes on and talk about the mental health piece. If you feel you may be having some mental health issues, make sure you contact your primary health care physician. They may be able to guide you to who you may need to go ahead and talk to get the help that you need. So on today, guys, I'll be talking about mental illness in children and know the signs. Guys, children can develop the same mental health condition as adults, but their symptoms may be different. Know what to watch for and how you can help. Mental illness in children can be hard for parents to identify. As a result, many children who could benefit from treatment don't get the help that they need. Understand how to recognize warning signs of mental health or mental illness in children and how you can help your child. What is mental illness? Mental illness is an overall wellness or how you think, regulate your feelings, and behave. A mental illness or mental health disorder is defined as a pattern of change in thinking, feeling, or behaving that causes distress or disrupts a person's ability to function. Mental health disorder in children are generally defined as delays or disruptions in developing age-appropriate thinking, behaviors, social skills, or regulations of emotions. These problems are distressing to children and disrupt their ability to function. It affects their ability to function well at home, in school, or in social situations. Barriers to treating childhood mental health disorders. It can be difficult to understand mental disorders in children because normal childhood development is a process that involves change. Additionally, symptoms or disorders may differ depending on a child's age, and the children may not be able to explain it to you. You might not be able to explain how they feel or why they are behaving a certain way. Other factors may also prevent parents from seeking care for a child who has suspected mental illness. For example, parents might be concerned about the stigma associated with mental health, the use of medications, and/or the cost or logistics changes in treatment. So guys, the parents may not know, or they may suspect something, and that's why they always say you may need to go to your child's provider, so that if you feel your child's having an issue, you may need to talk to the child's provider, because they may be able to connect you with someone that can get you the necessary help you need. And as a parent, you may not see right away, but you can see changes or differences in your child that may be saying that they have a mental illness, but you may not know. So that's why I say it is best to check with your child care provider for that child, because there are common disorders among children, and I'm just going to name some. There's anxiety disorder. There's also attention deficit disorder. There's also ADHD, autism spectrum disorder, which is a big one we hear a lot about, because they're on a spectrum. So that means there are different types of disorders and the way that they come out. Also, children can have eating disorders. They can have depression and other mood disorders. They also can have PTSD, which is post-traumatic stress disorder. They can also have schizophrenia. And then it talks about, like I said earlier, what should I do if I suspect that my child has a mental health condition? Just like I told you guys, make sure you consult your child's healthcare provider so that they can send you to where you may need to be to get a diagnosis or to find out what procedures you may need to take to have that child tested and check for any type of disorders that they may have. And make sure you're checking with them. And says another things you can do is also, you can talk to your child's teacher, a close friend or relatives or other caregivers, because those caregivers may see signs and things that you may not see, and they can pinpoint and help out. And your caregivers to see if they've noticed changes in your child's behavior. Share information with your child's health care provider. So guys, if they're in school, and for me with my daughter, when I found out she was had some issues, I found out through her healthcare provider, not healthcare. I found out through her school. So that's how I kind of found out that my daughter had some issues. So after I found out she had some issues, I went ahead and had her tested. And even though once I had her tested, guys, for us, the stigma of knowing that your child has something going on is kind of hard for parents. So first, for me, when I breathe hard is because I remember when they tested my daughter and they was telling me some things that came up. And even for me, the first thing is for parents, the acceptance of knowing that your child has an issue. Acceptance is the biggest thing in anything that you're going through, because you have to accept the fact that something is going on. And then you have to react to knowing, as a parent, knowing how you feel. And then after you figure out how you're feeling and get yourself together, then you have to figure out what you need to do for your child. And in the world that we live in today, it's not easy. But we know with COVID and all the things that happen, that children are different. They having so many different things that are going on. So as parents, if our caregivers or people are telling us that our child is having an issue, just try to accept the fact that they have an issue and try to get the help that they need. And sometimes that's kind of hard for us as a parent. But guys, we need to make sure that we are doing what we need and getting the necessary tools for our children also. And that is very important, that we take care of what is going on. And guys, it is not easy, because just like I taught you guys, it wasn't easy for me, but I have learned to deal with situations when they come up. I've learned to trust God through everything that happens. So guys, make sure you are taking out some time to love on yourself and do something special for yourself. And guys, make sure you're taking care of your mental health. It's so very important that we do that. And make sure you just take care of yourself. If you see a loved one, a neighbor, a friend that are having some issues, make sure you may be that very one that sends them or helps them or let them know that they need to get help. So guys, I'm not going to stay on long. Just want to let you know, don't forget to like, share, and hit the notification bell, so each time I load up a video, you can see it. And don't forget, guys, to put something down in the comments to let me know if you are still liking these videos. Mental health is near and dear to my heart. And also, guys, don't forget that May is Mental Health Awareness. But for me, guys, mental health awareness is 12 months out of a year, because mental health is real. So guys, thank you. Have a blessed Monday, and I will see you in the next one.